afternoon, ma'am. I'm Dr. Thames.
Oh, hi, Dr. Thames. Thank you for coming to see me.
Well, thank you for coming today as well. Could you tell me what brought you into the ER today?
Well, I came because I had some surgery 10 days ago, and I still have a great deal of pain in my chest.
All right, all right. Are you feeling any shortness of breath or anything as well?
Yeah, come to think of it, I started feeling short of breath when I started getting ready to come here.
Okay, okay. How long? So you've been shortness of breath just since you started to come here? Not very long?
Not very long.
Not very long, okay. And you said you've had recent surgery?
Yes, for reconstruction from breast cancer surgery.
Okay, okay. And how long ago was that?
10 days.
All right. I see. So now I'm going to perform a leg examination on you.
A leg?
If you don't mind. Yes, ma'am.
You're going to start with the leg?
Start with the leg.
Whoop! Got cold hands.
All right. It seems that there is a red tender spot on the left side of her left leg. Also, the patient is cyanotic and seems to be sweating profusely. Now it's time for vital signs. All right, ma'am, I'm just going to listen to your heartbeat.
Okay.
Her temperature and blood pressure seem normal, but she has a very weak pulse. Ma'am, I'm afraid we'll need to run some more tests.
No.
I'd like to start off with something called a D-dimer, which is a blood test that checks that if you have a certain protein in your blood. After that, I would like to do
this morning.
I would like to do a ventilation perfusion test, which is basically a lung scan that's going to show us how much blood is getting into your lungs. Finally, I would also like for you to have a spiral CT scan. It's very quick, and it will give us good images of exactly what's happening with your lungs.
Are these tests necessary?
Yes, ma'am. They're very necessary to your well-being. Several minutes later. Maybe more like an hour later. The patient's results show a positive D-dimer, diminished blood flow to the lungs, and what looks like a mass in one of her pulmonary arteries from the CT images.
Oh, no.
With all of these findings and your symptoms, I feel confident that we can diagnose you with...
Oh, my goodness. Am I going to be okay?
With quick treatment, you should have a good prognosis. We'll start you out on heparin, which is an anticoagulant. It'll just be on a drip.
Yeah.
And if things become more serious, you may need surgery. But we'll see about that when the time comes.
Okay.
Another hour later.
Hi, Dr. Thames.
Hello
I feel
there.
so much better.
Your tests show that everything is back to normal now. So you feel better?
Yes, ma'am.
All right. Well, if you want to know what happens now, you're going to rest for a couple more days, but you need to make sure that you get up and have some physical activity as well. The most important thing now is to make sure that this doesn't happen again.
Well, do I go home on some medicine?
Yes, we'll put you home on Coumadin, which is another anticoagulant.
Oh, and do I take that by mouth? By my mouth?
Yes, you do.
Okay.
To prevent it, make sure you will have to have a dose of heparin before you have any more surgeries or before you're going to be sitting for a long period of time, like on an airplane. And also, you need to maintain a healthy weight, avoid smoking, and go to the doctor regularly to check for heart and lung disease. Most of all, be familiar with the symptoms.
Yes.
If it does happen again, you'll be ready.
I feel so ready, Dr. Thames.
Another case solved.